Hi, everyone, and welcome to the webinar today. It's great to see so many of you have joined us. So the title of the webinar today is Person-Centered Support, Inclusion and Transparency. So we'll be touching on the themes of inclusion, transparency, and the Person portal. So just a quick introduction on what we've covered in our previous webinars in the last couple of months. So the last couple of webinars we're looking at how social care has been moving forward as we're emerging from the pandemic, what lessons can be learned, and potentially what part technology has to play in the future of social care. I think a lot of organizations have found that the need to move off paper-based systems and to digitizing systems, and the pandemic's been a little bit of a catalyst into that. So, and also a lot about how providers can benefit from the move to digital solutions. And I guess there's been a lot of case studies coming out of the pandemic whereby organizations have had to roll out mid-pandemic, and how that's kind of affected their organizations and their working routines and everything going forward. So the shift to digital is truly the future. I'm going to hand you over to Chris Tanner now. He is a client manager here with Aspirico, and he's going to talk through the themes that we have discussed previously, and then also the theme of inclusion. And following that, he'll be doing a demo of the system. So over to you, Chris.
Thanks so much, Siobhan. Good morning, everyone. Nice to see so many people here. Thank you for your time. So yeah, just following on from what Siobhan said. So we've been looking this sort of series of webinars with, as we said, we emerged from the pandemic and people are starting to catch their breath a little bit. Just looking at what's going to come out of the back of, what might potentially be coming out of the back of that in social care. So we've had a look at the sort of area around social care management, particularly around LD support, mental health support, aged care, and physical disability support. Those, the elements around managing that kind of service. We've looked at care and support planning, and we looked at quality compliance, record keeping, and of course we looked at location management, incident management, the reporting side. Now, so far, the last couple of webinars, we've been looking at that much more from the provider side, what providers can benefit from in terms of, people are starting to look at their systems and processes now. But today, we're going to look at inclusion. So that inclusion piece is, it's looking at ultimately where everyone is in this sector to improve the lives of people, whether they have a learning disability, mental health issue, later on in life, whatever it may be. And ultimately, we're doing this for them. The care and support plans we've looked at belong to them. So it's how do we include people in that process? And I think to start off, to set the scene on what we're going to look at today, I think it's important to see, why is inclusion important? And really, I think that inclusion forms the foundation of a person-centered approach. So traditionally, my own background, I spent over a decade managing services myself as a registered manager and regional ops director, and also as project consultant on a few projects relating to new models of care and looking at innovation. And one of the things I've learned, and one of the things that I think the sector has been moving towards recently in that person-centered approach, if you look at traditional approaches and legacy systems, when I say legacy systems, I mean systems that were developed 10 years ago, whether they're paper-based or electronic, the approach tended to be quite generic. So, a service was designed and everyone got that service. They were institutional. So that same service was then provided. People were shoehorned into a service model. And very often, certainly from my own personal experience, they're often deficit-based. We're looking at what people can't do. Particularly a lot in the aged care sector myself, the focus was on what people are unable to do for themselves anymore. But even across the spectrum, across learning disabilities, mental health support, and physical disabilities, everything was geared around help supporting someone to do something that they can't do as opposed to what they can do. They're very input focused. If you look at a lot of processes, and part of it's from the regulatory nature in the UK and Ireland, part of it's because of commissioning practice, some of it's down to funding, but I always found there was a lot of time spent recording what you're doing, not what's going into a service rather than what impact it's having, and very risk averse. So, and again, it all comes down to being such a heavily legislated sector. There's a lot of paperwork I've worked with, for example, which is based around covering the provider to make sure that they tick every box. So you end up having reams and reams of risk assessment. But ultimately, what that means is that you're restricting what the people you supported can actually do, because of that risk averse. So as we start moving towards a more person-centered approach and the ethos behind iPlanet, people now are looking at much more personalised support plans. People have choice and control over their plan, over how their service is delivered. It's far more independence orientated. So we're looking at people being able to maintain their own independence, looking at their own daily activities. And we're looking much more at what people can do. Draw on personal strengths. Let's base their support plan around what they can do, and let's improve on that. We can support people with the things they can't do, but things like when you think about it in everyday life, personal care and input into personal care doesn't make any difference to my life. I just get out, washed and dressed every day. Life starts once I'm up and washed and dressed, and you go to work or you see your friends or you engage in an education activity. So we're focusing more on that, and that ultimately leads to that outcome. So building support plans, building your services around what people want to achieve, not what you're doing. It's more about what they're achieving. And it's about being risk aware. Obviously, there's always going to be risk involved in any service, but that means being aware of those risks and preparing for them. You can never eliminate risk, but you can mitigate for them. And this approach is over 12, 13 years ago when we first started building iPlanet. The foundation of iPlanet was built on this idea of a person-centered approach. So I'm just going to move over. So just look at how we built iPlanet. I do apologise. There's a box there that should be there, but we started with a supported person. So we took, rather than build a system where we have a lot of sort of pre-configured forms that you just shoehorn the person into, we actually started with the person and built the system. The architecture, the software is all built around that person supported. And what that means is, for the people supported, they're put at the heart of the service. For providers, it puts all of your people at the heart of all of your services. Then we built around the individual's outcomes. And what that means for people supported is their outcome focused services is much more independence orientated. We're looking at what they can do and what they want to achieve. For providers as well, it produces, it means that we can produce really rich data on how those outcomes are being achieved. You can analyze what is and isn't working. And also, I think, iPlanet places itself very well for outcome-based commissioning, which is moving over the horizon as different commissioning bodies look to move to a more outcome-based commissioning model to move away from that traditional time and task input-focused approach. So then we built the support plans and we integrated risk management into that. They're not separate processes. That risk management shouldn't, risk management isn't there to eliminate all risks. And then you build a support plan. You need to build a support plan and identify the risks involved in achieving what you want to achieve. So what that means, as we took that approach with iPlanet, support plans are highly configurable, which means that providers can build clear, detailed support plans for their staff to follow. But for the people supported, it makes them accessible and easy to use, but you can configure them to suit your own service so that they are easily personalised for each individual. Even though you may have one type of support plan, you can personalise them, and I'll show you what that looks like in real life. And then we've built the person portal. So this is for supporting people to access their own records. And this is where that box should have come in. But what that means is that it promotes inclusion, because the person has access to their support plans, their outcomes. They can see what their service is. Ultimately, the support plans don't belong to us. They belong to the person. They can also, through the portal, you can involve a wider circle of support, family, friends, and other support networks. So it provides a real level of ownership, but also it allows providers to take a co-productive approach to developing services, developing plans. Then we took all of this underlying architecture, put it on the cloud, so we've got real-time data. So everything is happening in real time. In real life, you can see it. So for providers, you can monitor quality and compliance as it happens, and you can evidence best practice because of the rich data set that comes out the back of that. But for people supported, you're really ensuring that effective, the responsiveness and the safety of those services, because if something hasn't happened, you know about it straight away. If something's gone wrong, you know about it straight away. So that's really useful in ensuring things are happening. Support is a it's a live, constant process. It's not something that's easily reviewed on a monthly basis. It's happening now. And then from that foundation, over the years, we've worked with the customers, providers across the sector to start building additional provider tools. So for providers, that's things like incident management, location management, which we've looked at, managing referrals, assessments, and just ensuring that your day-to-day operations are organised and efficient, and that that you can evidence that best practice. But what that means for people supported, even with provider tools, as providers save time on managing all the other things that aren't service-based, like managing incidents, managing locations, going through the referrals process. Less time spent doing that means there's more time to focus on their service delivery, and that data that informs quality and compliance and drives continuous improvement only can benefit the people supported as well in your service.